Hello students, let's study measles, mumps, rubella, rabies, polio viruses. So let's see first mumps, most common cause of parotid gland enlargement in children, pathogenesis, transmission, respiratory route via droplets, target site salivary glands, testes, pancreas, ovaries, mammary and CNS. Clinical manifestation in apparent infection up to half of the infected people either asymptomatic or present with non-specific symptoms like fever, myalgia and orexia. Bilateral parotitis, epididymoortitis, aseptic meningitis, and euphoritis pancreatitis are the complications. Laboratory diagnosis, specimen buccal or oral swab, antigen detection by direct immunofluorescence test, viral isolation by using primary monkey kidney cell lines or by shell vial technique, serum antibodies by ELISA neutralization test, HAI test, RT-PCR detects viral RNA. Mumps vaccine live attenuated Jeril Lin strain. Measles virus. Measles is acute, highly contagious childhood disease characterized by fever, respiratory symptoms followed by typical maculopapular rash, pathogenesis, transmission, droplet inhalation, clinical manifestation. Disease can be divided into three stages: prodromal, eruptive, and the post-measles stage. Prodromal stage, fever, Koplik spots, non-specific symptoms. Eruptive stage, rashes typically appear first behind the ear, then spread to face, arm, trunk, and legs, then fade in the same order after 4 days of the onset. Post-measles phase, weight loss and weakness, complication otitis media bronchopneumonia, CNS post-measles encephalomyelitis, measles inclusion body encephalitis, subacute sclerosing and encephalitis. SSPE, laboratory diagnosis, specimen nasopharyngeal swab, antigen detection by using anti-nucleoprotein antibodies, virus isolation, inoculation of specimen into monkey or human kidney cell line, produces CPE, multinucleated giant cell body Finkley cells. Reverse transcriptor PCR detects viral RNA. Measles vaccine, live attenuated vaccine, combined vaccine, measles vaccine combined form with rubella, MR vaccine with mumps and rubella, MMR with varicella, MMR-V vaccine. Indication measles rubella vaccine is given at 9 completed months to 12 months along with vitamin A supplements and second dose of MR vaccine at 16 to 24 months. Here you can see Koplik spots in buccal mucosa in measles rash on face and multinucleated giant cell of measles infected cell line. Rubella, German measles, pathogenicity, rubella infection, postnatal and congenital infection. Postnatal infection, rash, prodromal precedes the rash, includes low-grade fever, malaise, and upper respiratory symptoms. Rash, generalized and maculopapular in nature. Foramer spots are there. Complications, arthralgia and arthritis. Congenital infection, highly teratogenic, affects ear, deafness, eyes, cataract, and heart, patent ductus arteriosus. Laboratory diagnosis, isolation of virus, nasopharyngeal or throat swabs taken 6 days before and after the onset of rash, ideal cell line, monkey or rabbit cell. Serology, antibody detection, ELISA detects both IgM and IgG. Molecular test, RT-PCR available for detecting rubella-specific RNA. Rubella vaccine, RS27/3 is a live attenuated vaccine. Hello students, welcome to this session. So I, Dr. Rajashri Mutha, going to take your lecture on rabies virus. Now we will see morphology of rabies virus. So it is bullet shaped, enveloped, lipid envelope is two layers. It consists of hemagglutinating peplomer spikes, glycoprotein G, and envelope is lined internally by a layer of matrix that is M protein. Nucleocapsid, it has helical symmetry and comprises of single-stranded negative sense RNA and nucleoprotein and polymerase proteins. Now we will see spread of virus. So transmitted to humans by bite of infected dog, then it replicates locally, that is in muscle or connective tissue. Then virus binds to acetylcholine receptor at neuromuscular junction. Then it goes to centripetal spread along motor nerves of the muscle fiber. Then it will go to dorsal root ganglion of the spinal cord. Then it will go to hippocampus and cerebellum. Then centrifugal spread along nerves to salivary glands, skin, cornea and other organs. Rabies virus causes rapidly progressive acute infectious disease of central nervous system in human and animals transmitted from another rabid animal, either dog or others like cat and bat. Almost it is always fatal. Clinically, there are three stages: prodromal stage, acute neurological phase, and third is coma and death. So, in prodromal phase, it is characterized by non-specific symptoms such as fever, malaise, anorexia, nausea, vomiting, photophobia, sore throat, abnormal sensation, paresthesia, pain, and pruritus around the wound site. Acute neurological phase is of two types: encephalitic rabies and paralytic or dumb rabies. So, in encephalitic rabies, hyperexcitability is there, autonomic sympathetic dysfunction like increased lacrimation, increased salivation, then increased perspiration, that is sweating, then goose flesh, cardiac arrhythmia, and hydrophobia, that is fear of water, and aerophobia, that is fear of air. In paralytic or dumb rabies, so it is there in 20% of cases. So especially in people who are partially vaccinated or infected with bat rabies virus. So it is characterized by flaccid paralysis, quadriparesis with flaccid facial paralysis. And third is the coma and death. The lab diagnosis, the base specimen is hair follicle of nape of neck, most sensitive specimen, and other can be corneal impression smear. The rabies antigen detection is the second method of detection. So direct immunofluorescence test. So to detect rabies nucleoprotein antigens in specimen by using specific monoclonal antibodies tagged with fluorescent dye. And it is a gold standard method. Virus isolation can be done by mouse inoculation. Intracerebral inoculation into suckling mice can cause encephalitis and death in the mouse. Brain biopsies can be examined for Negri bodies and rabies antigen. Antibody detection of CSF antibodies is more significant than serum antibodies. Reverse transcription polymerase chain reaction can be used to amplify genes of rabies virus RNA from fixed or unfixed brain tissue. So this is lab diagnosis. Now we will see national guideline for rabies prophylaxis. So category 1, so that means no risk is there. So type of exposure is touching or feeding of animal, leaks on intact skin. So recommended prophylaxis by WHO, no treatment needed if history is reliable. Category 2, minor risk, minor scratches or abrasions without bleeding or nibbling of uncovered skin. So recommended prophylaxis by WHO is wound management, rabies vaccine, observe the dog for 10 days. Category 3, major risk, so single or multiple transdermal bites with oozing of blood, leaks on broken skin, fresh wounds or mucous membrane, bite by wild animals or bat. So prophylaxis by WHO is wound management, rabies immunoglobulin, rabies vaccine, observe the dog for 10 days. Now let's see about rabies vaccine. So there are two types of rabies vaccines, neural vaccines and non-neural vaccines. So neural vaccines derived from nervous tissue of animals infected with fixed rabies virus no longer is used since 2004 because they are encephalotogenic, associated with serious risk of neurological complications. The examples are sample vaccine and infant mouse brain vaccine. Non-neural vaccines, they are cell line derived vaccines and they are currently used. So PCEC is purified chick embryo cell vaccine, PVC is purified viro cell vaccine, HDC is human diploid cell vaccine. So the regime for rabies vaccine for the post-exposure prophylaxis. So there are two regimes. So regime 1 is intradermal 222 and regime 2 is intramuscular PEP regimes. Total 4 doses are there. So in intradermal total 6 doses are given. Two site intradermal vaccine is given on 037 days and intramuscular total 4 doses are given. So there are two schedules for this. So one site intramuscular vaccine, so the one site 037 and fourth dose is given between 14 to 28. So 037 and 14 or 28. Two site intramuscular vaccine given on 0, then one site intramuscular on 7 and 21. So that means on 0, 2 injections intramuscular and then 7 and 21. So total 4 doses are there. So in intradermal PEP regimen, total 6 doses are there. In intramuscular PEP regimens, total 4 doses are there. Hello students, welcome to this session. So I, Dr. Rajeshri Mutha, going to take your lecture on polio viruses. So morphology of poliovirus. So it is non-enveloped, spherical shape and have icosahedral symmetry. The capsid is composed of 60 subunits, each consisting of 4 viral proteins VP1, VP2, VP3 and VP4, and it possesses single-stranded positive sense linear RNA. The poliomyelitis is a highly infectious childhood disease causing acute flaccid paralysis and involvement of nervous system. The transmission is fecal-oral route most commonly and rarely by respiratory droplets via inhalation or conjunctival contact. Then in spread, they multiply locally in intestinal epithelial cells, submucosal lymphoid tissues and tonsils and Peyer's patches. Then spread to central nervous system and spinal cord. Through hematogenous spread is most common. Virus spreads to regional lymph nodes, spills to bloodstream, primary viremia, then multiplication reticuloendothelial system enters the bloodstream, again causing secondary viremia and carried to spinal cord and brain, that is central nervous system. Clinical manifestations of poliomyelitis. So first is an inapparent infection, that is asymptomatic cases 91 to 96%. Then abortive infection, so minor illness manifested by fever, malaise, sore throat, anorexia, myalgia and headache, seen in 5% of cases. Least common form seen in less than 1%. So it is non-paralytic poliomyelitis, that is causing aseptic meningitis in 1% cases, and paralytic poliomyelitis, it is descending asymmetric acute flaccid paralysis, AFP, acute flaccid paralysis. Proximal muscles affected earlier than the distal muscles. Paralysis starts at hip, proceeds towards extremities, leads to characteristic tripod sign, that is child sits with flexed hip, both arms are extended towards the back for support. Lab diagnosis. So first is specimen. So can be throat swab up to 1 week of illness, and after that rectal swab or the stool sample. Transport should be transported in frozen during transport to the laboratory. Isolation. So cell line can be used like primary monkey kidney cells. The viral growth identified by cytopathogenic effects like crenation or degeneration of entire cell sheet, or antigen detection or PCR method using VP1 region of the poliovirus. Then antibody detection, and next is the real-time multiplex reverse transcriptase PCR developed using primers from VP1 region. Now let's see about prophylaxis, that is polio vaccination. So National Immunization Schedule India 2020. So there are two types of polio vaccines, injectable, that is IPV, and oral, that is OPV. So IPV is the Salk and OPV is the Sabin. Then in IPV, injectable polio vaccine, 2 fractional doses intradermal route at upper arm given at 6th and 14th week of the age along with bivalent OPV. Then oral polio vaccine schedule, so total 5 doses, 2 drops per dose orally of bivalent OPV, serotype 1 and 3. So 0 dose, that is given at birth, and then first, second, third given at 6, 10, 14 week respectively, and then booster given at 16 to 24 of the months. The safety, injectable vaccine is safer than OPV. The OPV vaccine is safe except in immunocompromised and pregnancy and old age. Polio eradication. Poliomyelitis is now at the verge of eradication, attributed to the extensive immunization program being conducted globally. So, pulse polio immunization (PPI) was initiated globally to eradicate poliomyelitis. In India, it was in operation since 95-96. Two rounds of polio pulse immunization 6 weeks apart are scheduled every year during the winter season, where all children under the age of 5 years are vaccinated with OPV irrespective of their OPV vaccination status. PPI doses of OPV are considered as extra doses and they do not replace the OPV doses received under the routine national immunization schedule. And acute flaccid paralysis surveillance is also there in polio eradication program.
Hope you find this session useful for your understanding and for your exams. Thank you.